It is important to make sure that we have mental health professionals and those within the congregate care field who are actively involved in the development of policies, as well as just oversight with legislation to ensure that it truly is meeting the students' needs. This year, the Department of Health and Human Services has allowed us to create a committee that has several representatives that work in congregate care, and they are actively working with the legislative team to ensure that our legislation keeps everybody safe and is meeting best practices, and most importantly, taking care of adolescents' mental health needs.
I'd rather be on the forefront of driving change than being told that this change has to be made. I like to gather data and have information and constantly be looking at the environment here at Elevations, as well as the environment in this field, to see where we can improve. We always can improve. Once we think we're there, there's another place to go. So I would rather have my own insight into that before somebody else says, you know what you're not doing well at? It's this. I want to know, you know what we're not doing well at? We're going to do that better. So we always want to be out there in the forefront, and having a voice in that is really critical. If we sit back and wait for somebody else to tell us how to change, we are only going to be resentful about the changes that we need to make. If I get out there and say, this is what I think we can do better, and my guess is everybody else can do better in this, if we're struggling in it, you guys are probably too, let's come up with an idea to drive that change and present it to those people that are in positions to require those changes. I want to be a part of a field that is constantly forward-focused, forward-thinking, and improvement-focused. And I would like to have a say in where that goes. Sometimes lawmakers have particular ideas about this world, this field, especially as it relates to residential care. And I would rather have input into what is reality, give that to them, and then let them make the decisions they need to make. If I can contribute to that conversation, that only ends up better for us. It only ends up better for students. It only ends up better for the entire field.
Public advocacy is very important. The hesitation for most people is they don't want to get the bullseye of the undue attention that often comes with that. But I feel very strongly, as does our program, that it's important to make sure that we are willing to take the risk of getting some undue attention to ensure that the kids have what they need. It's very important that the kids are getting best practices met, and that kids are getting what they need from both our community and from their mental health providers. And if we stay silent, most likely that isn't going to happen. So it's really important just to put yourself out there and take the risk and do what needs to get done to make sure that we are providing quality care.